Sleeve gastrectomy is a procedure used for patients, who require an operation to lose weight. It is one of the weight loss procedures. Originally, it was done before 1992 as part of a different major weight loss operation. But then we started to offer sleeve gastrectomy as a primary procedure, someone wishing to lose weight. The operation involves a laparoscopic keyhole technique, and the stomach is detached from surrounding structures like a spleen and the large intestine. And following that, the anesthetist will pass a tube, what we call is an orogastric tube, to give the surgeon an idea of how much of the stomach needs to be removed or left behind. So there is always a fine balance between how much is removed and then how much is left, because if you leave too much of stomach behind, and they won't lose weight, and if you take too much away, and there is a risk of complications. So idea is to remove 2/3 of the stomach away, okay? But that depends on the patient's stomach size and also the surgeon's experience and practice. So how the sleeve gastrectomy works is by removing 2/3 of the stomach, a long, narrow tube is created, which instead of a large sac. So it restricts the amount of food patients can consume after the operation. And also, part of the stomach called fundus, it is the top end of the stomach. It secretes a hormone called ghrelin. It normally increases appetite. By removing that part, the satiety center is satisfied early, which means patient feels satisfied as soon as they eat only small portion of food. So they lose hunger. So there is a combination of restriction and also a loss of appetite. But there are lots of studies being done recently to suggest that there are hormonal imbalance is being reverted after the sleeve gastrectomy, which means as you know, obesity is a multifactorial problem. There are lots of reasons why one would gain weight. One of the reasons is a hormonal imbalance. Their metabolism goes down and they eat more, whereas after sleeve gastrectomy, the metabolism increases and they lose appetite. So that's how it works. I think the jury is still out regarding who is most suitable for sleeve gastrectomy. The reason to make that statement is it is dependent on in each center's practice and also patient's requirement. But in my practice, I offer sleeve gastrectomy to anyone who does not require more malabsorptive procedure like gastric bypass or single anastomosis gastric bypass or SAD-AS procedure. In those patients, I use sleeve gastrectomy to help the patients. There are certain conditions which would stop me from offering, or at least consider me to offer different procedures. If a patient with the diabetes, and they're better off having another operation to achieve long-term resolution of diabetes. But then again, it depends on the weight of the patient. If the patient is a lighter BMI, not BMI 50 or 60, sorry, they would benefit from having sleeve gastrectomy. And if a patient has a pre-existing gastroesophageal reflux, they may not be suitable for sleeve gastrectomy. And also, I tend not to offer sleeve gastrectomy to patients who are who have weakness for sweets and snacks. Yes, it is a permanent procedure because once a part of the stomach has been removed, and it is irreversible. There are general complications like infection, bleeding from the staple line. We use staples made of titanium to cut and seal the stomach, and sometimes the patient could bleed from that, or damage to other structures like with the laparoscopic surgery, it can happen. In order to reduce the complications, all patients who undergo laparoscopic sleeve gastrectomy, I subject them to liver shrink reduction diet, which is basically a low-calorie diet for 2 to 3 weeks based on their body mass index, that encourages them to lose some weight. As a result, the liver and inside abdominal fat size will reduce. So that reduces the risk of any complications like damaging spleen and liver, other structures. There is a risk of clot formation after these operations, and to minimize that risk, we offer them mechanical protection like all patients would have TED stockings, and during the operation they would have a electric cough pump to improve blood circulation back to heart, which reduces clot formation in the legs and lungs. And also they receive blood thinning injections, what we call as a subcutaneous heparin injection, to protect them from developing clots. And they continue to receive those medication in my practice for 4 weeks after the operation. And there is a risk of healing problems along the staple line. And if the healing is not good, there might be a dehiscency or gaps in the healing of the staple line, which means the stomach contents will come out into the abdominal cavity and then make them unwell. During the operation, we do methylene blue test or air leak test, which basically means the anesthetist, when through the orogastric tube, he pumps a blue color fluid or air to check there is any leak. And if there is a leak at that time, I would be able to reinforce the staple line with sutures. And this leak complication can take place up to 4 to 6 weeks. But majority of the leaks do happen within a week or two. And there are some risk factors for these patients who develop a staple line leak. There are some patient factors and some technical factors. And patient factors include uncontrolled diabetes, smokers, excess alcohol intake, or if any patient who is on immunosuppressant medication like steroids or other medication for different conditions, because it reduces the wound healing ability. Fortunately, that risk is very small. It's only 1 in 250. There are certain other very rare complications which may not happen in the normal practice, but patients do need to understand that they need to be compliant with the diet and guidance from us, especially regarding multivitamin and other nutritional supplements. If they don't take nutritional supplements, they can develop severe malnutrition. As a part of the process, when they start losing weight, they all develop massive excess skin. It is not a complication, and you could see it as their sign of success. But quite a few patients do require further surgery to deal with the excess skin. Patients can expect 60 to 80% of excess weight loss over 12 to 18 months after surgery. But it's a tool, and the success is determined by how well the patient uses the tool. So there is a long-term weight regain after any of the weight loss operations. That's why it is quite important for the patient to adhere to the dietary guidance.